Have you ever heard of mental health occupational therapy? If not, don't worry. Many people get us confused with occupational health or believe we only supply bath boards and raised toilet seats. This is because our role isn't the easiest to understand at first glance. On the surface, it can seem that we're just facilitating various activities, but this simply isn't true. We use all and any activity or occupation as a medium to assess, treat, and rehabilitate our clients. We can find out so much when we're doing something as simple as making a cup of tea. We're assessing things like motor and sensory processing, cognitive function, executive function, a person's environment, their physical ability, their mental state, and so much more. Our clients select the activities that are relevant to them, and then together we break these activities down, figure out what's getting in the way, and find solutions so that the person can carry out the things they need and want to do independently. In our practice, we combine the powerful approaches of occupational therapy and coaching. To be honest, there's many similarities between OT and coaching. In both, we do with, not for. Occupational therapy comes in when the person's really struggling, when their mental health difficulties have left them feeling as if they're stuck at the bottom of a well. All the talking in the world at this stage isn't going to work, and it's so stressful down there that the coaching method of asking questions to elicit solutions from the person isn't going to cut it either. So the OT climbs down into the well, and together with their client, they create a way up and out. They might make footholes in the sides by pulling out some bricks or use some materials that they can find on the floor to make a ladder. This is the more directional, hands-on way of occupational therapy, designing solutions to get people back on deck. Then, once they're up and on the outside of that well, we use the coaching and OT combined to support the person to learn to move away from the well and on with their lives. We are all about doing and function. Obviously, as we work in mental health, we've been trained to engage people and process issues through talking. When we talk, we do our best thinking. And so with talking techniques, we can uncover what's driving certain patterns and behaviours. But then we take it further. Alongside talking, we're focused on function. It's amazing what you can find out from a person when they're relaxed and engaged in purposeful, meaningful activity. We look at what you need and want to do and how we can achieve these occupations and maximize independent living and optimal function. What makes us more than coaches alone is that we're trained to deeply understand the conditions that affect our clients. We have that clinical background for those times when the tools and strategies don't work. We have the know-how and we can unpick the reasons for what might really be going on.